Okay, thank you. Good morning, and thank you to Vision RT to invite me to talk about our experience in our unit. A brief introduction. In Marseille, at the Institut Pauly-Calmette, we have 4 machines and Vision Align RT on 2 of them, 2 Synergy, and we treated almost 900 patients with breast cancer and a few patients with other localization, and this is one of them I present you today. Okay, this is an old man, 86 years old, who was diagnosed with for a squamous cell carcinoma of the left external auditory canal in June 2018. Surgery first was performed with invaded margins, and a second surgery allowed free margins. Unfortunately, recurrence occurred in August 2018, and a new extensive surgery was done in October 2018 with, again, invaded margins. There was no node involvement on ultrasonography and CT scan imaging. Radiation therapy has been proposed, but at that time, the patient already suffered a major local recurrence with infection and necrosis, very painful. So this is the CT scan at diagnosis in November 18, and you can see the tumor in the auditory canal in red. We did a plan with 70 grays in 2 grays per fraction in the left tumor, and 56 grays, 1.6 grays per fraction in simultaneous integrated boost in the tumor and left nodes 1B, 2, 3, 5, 13, 9, 10A, and 10B in the left side. We tried to treat him with a closed mask till 22 grays, but the level of the pain did not allow the daily use of the mask anymore. So from 22 to 60 grays, we use Align RT for setup and motion management for the patient without any mask, just tape on the forehead and under the chin. I have pictures, and CBCT every 2 days. This is the first planning CT scan in December 18 with head and shoulders mask. Sorry. This is the photo. You can see the region of the left here with a big bandage, and the patient with the mask at the first scan and the first session was already very painful. And this is the second planning CT scan in January 19 without any mask, and you can see the tumor progression between the 2 CT scans. And the setup, just with tape, and this is a big bandage to avoid pain. For the plan, we use the same PTV margin, 1.4 centimeter, with and without mask, and you can see the 2 plans in December 18 and January 19. There is a slight difference due to the tumor progression between the 2 scans. The HDV with and without mask, there is no major difference. Without mask with solid line and with mask with dashed line. For the PTV, it's the same plan, the same constraint, and for the organ at risk, there are slight difference for oral cavity, brainstem, and bone marrow, but it's due to the tumor progression. The clinical goals with the 2 plan, it's difficult to read, but everything is green, as you can see, so it's okay for the constraints, except the temporal lobe, because it was in the PTV, in fact. So for the treatment without mask, we used Align RT, and the isocentric region of interest contain the nose to allow good control of the rotational motions, because it's the key of the treatment for head and neck cancer. The ears region was completely free of contention, and the eyes were closed. The rotation table was at 0 degree. This is the table of the motion management values. 0.4 centimeter for the vertical, longitudinal, and lateral degree of freedom, and for the rotational degrees, 3 degrees for each. During the treatment without mask, the stop beam occurred only once because of out of tolerance during the treatment. Only once on 19 fractions. And a CBCT was performed day 1 to 3 and every 2 fractions to be sure to be the treatment was okay. You can see two of them, which was good. And I evaluate retrospectively the duration of the sessions with and without masks. It was difficult because it was retrospective, and I saw on the TPS to calculate the duration of the session. So the median duration with mask on 11 fractions was 11 minutes, from 7 to 16, and the median duration without mask on 19 fractions was 13 minutes, from 3 to 35. So it was not really different. The difference was, of course, the day without CBCT with 9.5 minutes, and with CBCT with 18 minutes. The clinical result and evolution for the patient. We could perform the whole plane treatment from 22 gray to 60 grays, 2 grays per fractions, 5 days a week in the tumor and ipsilateral cervical nodes area with an acceptable tolerance for the patient. Unfortunately, the performance status decreased at the end of the treatment, and we should stop at 60 grays instead of 70 planned, but it was not due to the pain. It was due to the performance status. After a short time of stable disease, the tumor started to progress, and the patient had immunotherapy, but unfortunately he died in July 2019. In conclusion, the treatment for this patient could be achieved without any mask, with a good precision and an acceptable tolerance for the patient. The motion management with a linearity can be proposed, I think, in head and neck cancer radiotherapy with open mask, or in selected cases without any mask, especially if the treatment is focused on base of skulls, I think, because there is no much motion, and in ipsilateral neck, because the rotational motion is not so important that if you treat the 2 sides of the neck. But this is a personal impression. Thank you for your attention.